Hi, my name is Mackenzie Bowles. I am a senior here at Mississippi University for Women. I took my internship this semester and plan to graduate in July. I did my internship at Encore Rehabilitation of Gordo, or some people may call it just Encore Rehab. We're going to start with some basic information. Encore is a non-profit organization. The Encore of Gordo has a two-man staff that includes their therapist and therapy assistant. The therapist at Encore is Brooke Owens, and the therapy assistant is Cody Shirley. The reason that there is only a therapist and a therapy assistant is because of it being in a low population area. Staff qualifications at Encore include physical therapists must have a doctorate degree from licensed PT school and have passed boards. Physical therapy assistants must have a 2-year degree from licensed PTA school and passed boards. The common therapies at Encore are physical therapy, occupational therapy, and industrial rehabilitation. Again, since this Encore facility is in such a small town and area, there's not a whole lot of patients that are seen. This Encore does not usually see patients for sports medicine, athletic training, or speech-language pathology like therapies would see in a larger area. At this Encore, we saw a range of 15 and 30 patients a day. The reason that this range is so wide is because it depends on the day throughout the week. So on Mondays, Wednesdays, and Thursdays, both the therapist and therapy assistant was there. On Tuesdays, only the therapist was there. And on Fridays, the PTA only worked till lunch. So on the days that both therapists were there, we would see about 30 patients a day, which means each therapist would see 15 apiece on their own. A day in the life at Encore. Every day at Encore, I went from 8 a.m. to 5 p.m. Some days I took lunch, some days I didn't take lunch, just depending on how many hours I wanted to get that day. Each day as an intern, I was responsible for getting ice packs, hot packs, wiping areas down, changing pillowcases. I did the laundry, sweeping. Some days we mopped, and then anything else the therapist asked me to do. After being there for a little longer and getting more comfortable, the therapist felt comfortable with me helping some patients on what to do, setting timers, and making sure they were doing their exercises correctly. So I was able to work side by side with the therapist and some of the exercises for the patients. These are my likes and dislikes about my internship and doing it at Encore of Gordo. Some things I liked most about my internship was my mentors. I loved the mentors that I had because they cared about my knowledge and growth in this field of study. They also wanted me to make sure I knew what I was doing and what was going on, and maybe even what particular muscles, bones, etc. they were talking about, especially just depending on the type of patient we had. Loved my mentors. My relationships. I loved being able to grow personal relationships with most of the patients that I got to see, and most likely even helped. Learning. Every day at my internship, I was able to learn something that I didn't know or that I just had to be reminded of, and was able to even get further knowledge of something. Hands-on experience. Rather just learning from context, I was able to learn hands-on, which helps me remember things better and for the future. I'm one of those people that have always learned easier and better with hands-on experience. Now for the dislikes. There wasn't anything that I really disliked about my internship but one thing. And that one thing is downtimes. What I mean by downtime is when either we only had patients to do STEM with heat or ice and nothing to do, and when we didn't have any patients to be seen for a period of time. This only happened a very few times, but when it did, I always made sure that the laundry was done, everything was clean, ready for new patients, or I was able to ask my mentors and find something to do and even learn. Interesting patients. Case study 1. My case study 1, he was a 25-year-old male who was a full-time welder. He was a victim to an assault by gunshot. He was a former smoker and consumed alcohol before his assault. Since his gunshot wound, he has experienced numbness, tingling, stomach issues, and kidney problems. Because of the surgery, they had to take part of his kidney off, and then they also had to remove his gallbladder. He's in therapy to gain movement and strength in his right shoulder. He came to therapy for the first time 2 months before having surgery. He was already coming to therapy, but 2 months into therapy, he had to go back into surgery to remove the BBs in his shoulders that were causing problems with some shoulder movements. He comes to therapy 3 days a week. In the first month, his shoulder flexion around went from 0 degrees to 65 degrees. He began therapy with significant tenderness grossly over his right shoulder, as to now having mild to moderate tenderness. He has been very pleased with the progress he has made so far. Some of his exercises included pulleys, unweighted green ball roll-ups, wall circles, supine punches, supine circles, bicep curls, double wedge wash, and side lying punches. Interesting patients. Number 2. This is my case study 2. He's a 67-year-old retired male from a plumbing career and overall is a very, very healthy man. He is in therapy after a total left knee replacement. 15 years prior to surgery, he had left knee meniscectomy. He recovered well from this surgery, and 5 years after, he had left knee pain that progressively worsened. In the first month of therapy, his pain reduced from 7 to a 1. His plan of care is to come in therapy 3 times a week for 6 weeks and do at-home exercises instructed by the therapist. His knee flexion around went from 50 degrees to 97 degrees in his first month and is currently at 119 degrees. He has been very, very pleased with his quick progress he has made. I found this patient interesting because of his age, especially, and how well he has improved in just a few months in therapy. Some of his exercises including standing heel raises, long sitting hamstring stretch, passive extension stretch with heel on bolster, leg press, and passive extensor stretch on Cybex. Now we're going to talk about some special project info. What did I do? I trained alongside a PT to experience professionals to give me knowledge and prepare for my PT career. I cleaned treatment rooms and bed tables. I restocked supplies, disinfected equipment between appointments, freshened the vaso or ice therapy unit. What else could be done? I feel like I wish I could have gotten more hands-on experience learning to, stretch patients rather than just letting them do their exercises and making sure they were doing them correctly or just watching timers and cleaning stuff. But I'd rather, be able to give them a stretch or just kind of more hands-on. My overall experience. I had an overall amazing experience during my internship at Encore Rehab in Gordo. I feel that for anyone looking to go into this field of study and, maybe don't live in Mississippi but live in Alabama like me, I would highly request doing it here. Being here in Gordo helped me feel like I was meant to be there and, that I felt like I was home. My therapist mentor, Miss Brooke, told me that, if they were able to hire a PTA, I would be the first one she would call. But since they are so small and don't see as many patients as a larger facility, they aren't able to have one. I was able to learn so much at my internship and experience the day-to-day life of a therapist, knowing this is what I want to do. This experience helped me make certainty of if it was what I wanted to do and to continue doing. Now we're going to talk about some coursework. What I learned from my coursework. The main thing that I used every day and that I learned from my coursework was my vocabulary. This included kind of words like abduction, adduction, flexion, extension, etc. The next thing is I learned how to read a gonometer in a lab class that I was able to do at my internship. An example of me doing this was with my case study 2. He had a knee replacement, and when he came in for his eval, I was able to take the measurements myself under the watch of my therapist. I was able to understand majority of the bones and muscles that were talked about during evaluations of new patients or even just talked about in general. What was missing to me? I feel like the main thing that I wish I would have known going into my internship was learning how to place stem on a patient. The first time my therapist at my internship talked about stem in a TENS unit, I was a little confused because I've never been in a therapy facility before. But she helped me understand pretty quick on what it was, how it helped patients, and how to place them, and how, to set it up. This goes into like me wanting to know what a TENS unit is. I wish I would have learned about dry needling because our therapist, she had a certificate in or a degree in, dry needling. And then I wish I could have learned about the knowledge of exercises that are used based off of what a patient is needing therapy on. Next is my application of skills. The things that I learned during this kinesiology program that I used were taking blood pressure, reading a goniometer, calculating BMI, and body composition. That's the end of this presentation. I want to give a huge thank you to Encore Rehab of Gordo for giving me this opportunity to further my career in physical therapy and just taking me in and letting me learn and see what it's like in the real setting of a PT. Thank you.